Hello, and welcome to a very special episode of Questions from Quora. So tonight we're talking about probably the shortest question that I've ever answered on Quora. Should people wear masks? So let's start with the latest information. As of July 14th, 2020, which was one day ago as of this recording, the CDC is recommending that all Americans wear masks to prevent the spread of COVID-19. The CDC recommendations were fairly clear. CDC recommends that people wear cloth face coverings in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Cloth face coverings may help prevent people who have COVID-19 from spreading the virus to others. Cloth face coverings are most likely to reduce the spread of COVID-19 when they are widely used by people in a public setting. Alright. So this is as of yesterday. The CDC is recommending that when you're in public, when you're in places with recirculated air, confined areas around others that you don't live with, that you should be wearing a mask. So we can see based on this study of DIY and surgical masks versus 1 micron particles. The homemade masks, cotton t-shirts, off-the-shelf fabrics were able to capture 0.4% of the particles. That's a 70% effectiveness. And when we're talking about a virus that spreads so rampantly that it's not the mortality we're concerned about, it's the availability of hospital beds, of ICUs, of trained ventilator specialists. What we're concerned about is slowing that spread, and a 70% effectiveness, that's significant. You can see from this diagram that when an infected person who's asymptomatic, they're not showing symptoms yet, sneezes or talks, they're distributing a large amount of particles. They both come out as aerosol and droplet. They're coming out from the vapor that you exhale, the sputum. Every time you try to make this sound, sputum. All right, make a P. P. I guess that's not going to make a P. But, sputum. All right. So, the idea of the mask is that it's going to catch some of that biomass, the sputum, the saliva, those large particles that the virus travels in. Thanks to the Ohio Department of Health, we have another diagram that shows without surgical or cloth masks that you're exposing others to your droplets, allowing droplets to aerosolize and allowing droplets to settle on surfaces. Whereas when we use masks, whether surgical or cloth, we're reducing the viral load. We're reducing how much of that virus is transmitted, because we're not going to stop all of it. The virus is very small compared to the pores of a mask. However, the virus tends to travel in much larger macromolecules of sputum and saliva. So with our mask, we're going to stop a lot of that transmission. We're going to reduce the viral load that the people we're talking to are exposed to. All right, we're going to prevent 60 to 86% of droplets. That's a significant change. That's a significant reduction. Now, if we look at the breakdown of symptoms based on this organization, while fever is the most predominant symptom, going down just one, we have a dry cough. And while a dry cough may sound like it wouldn't have any sputum, there's still going to be expelled particles. It's not going to have the very large droplets of sputum, the very large things that we associate with that wet cough, with the expiration of sputum that we see. But a dry cough is still going to cause more expiration of the virus. And then moving down just 2 more, we have sputum production. And a third of patients, they're going to have increased sputum production, and 2/3 of patients are going to have a cough. So the ability of the virus to spread through our respiratory droplets is very significant. And as we saw in the last slide, we can reduce that by 60 to 86%. That's a huge change. All right. Now, if we look at the proportion of symptomatic cases, we can see that in very frequently it can take 5 to 10 days for patients to become symptomatic, which means that you don't know that you have the virus. You don't know that you have it when you start expelling those particles. So now we get to why this is a question. Because it really shouldn't be a question, but I understand why it is, and I don't judge anyone. All right? So Fox News in late June posted this screen picture. The World Health Organization's guidance on masks. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms like fever and cough. Now, if you're against wearing a mask or you think that there's some sort of conspiracy, I understand why this is a compelling screenshot. The only problem is Fox decided to take a snippet of a speech from almost 2 months earlier. And this is a novel virus. We started out comparing it to previously discovered and tracked and researched SARS and MERS type viruses, and we were making recommendations based on those previous exposures. So as we learn more, our recommendations are going to change. However, Fox decided to post a snippet of a speech that was almost 2 months out of date. However, when we go to the World Health Organization, they have things like this. First published on March 29th, 2020. Updated on 9 July based on updated scientific evidence. That's called science. Yes, the recommendations have changed over the last 5 months. They told us not to wear masks, then they said we could wear masks. They said we couldn't go to restaurants, then they said we could. Then they realized a whole lot of people were getting infected, so they went back to we can't go to restaurants. Yes, it has changed a lot, but that's what science is. Science is evolving. Science is evolution. Science is change. And science recognizes that change. This one little line, I loved it so much. I love this line so much because this is science. You want to know what science is? It's this sentence. We published this 3 months ago, and now we've had more evidence, we've had more research, we've learned new things, and we changed. We were wrong, but this is what we're going with now based on more evidence and more research. So yes, it's going to seem like the CDC or the World Health Organization doesn't know what they're doing. But that's not the case. They started based on previous diseases, and then as we get more evidence, as we get more research, those recommendations will change. I like to compare it to antibiotics. If you arrive in the hospital and you have a very bad infection, we start you with broad spectrum antibiotics. We hit you with powerful antibiotics that are based on suspected etiology. The suspected cause of your infection, we hit you with a very broad spectrum antibiotic. It's going to kill a whole lot of things, including things that are inside you that you need. So as we get test results back, as we get blood cultures, as we get labs back, what the doctor's giving in terms of antibiotics is going to change. It's going to become more narrow. All right? It's going to be focused on what the cause of your infection is. So we start out with this really broad procedure based on suspected etiologies, the suspected cause, and then as we get more evidence, as we get more data, then that antibiotic will change to a more narrow spectrum antibiotic that is designed for the infection you have. So it's not causing all those other problems in your body. So it's not destroying the natural flora in your mouth, in your stomach, in your reproductive organs. So that's what science is. That sentence right there, that's science. That's it. So here's one of the common arguments that we're up against. So Karen here is out without her mask. That's okay, because as you see, there's no one around. She's out in the open air, so she's probably not in too much danger. But let's look at Karen's sign. If you're wearing a mask, why would you care if I'm not? Your mask works, right? Well, see, the problem with this is we haven't taught people well enough about why we wear masks. No, Karen, my mask is to protect you and your mask is to protect me, because the mask is most effective at preventing the spread. So, if we look at this chart, we look at the different arrangements of symptomatic, asymptomatic, and healthy people. So, at the top we have a COVID-19 carrier without a mask, maybe like Karen from the previous slide, talking to a healthy person without a mask. There's a very high probability of transmission because there's no barrier involved. Then we have a COVID-19 carrier with without a mask talking to a healthy person with a mask. However, we see it's still a moderately high risk because, again, the mask is not about protecting me, it's about protecting you. It's about stopping the spread. All right? We go down a little bit more. Now we have a carrier with a mask talking to somebody without a mask, and all of a sudden we're at a low probability of transmission. And then we hit the very bottom. A carrier with a mask talking to a healthy person with a mask. That carrier, their mask is going to catch 60 to 80% of the droplets, right? The healthy person, their mask is going to catch some of them super low because their viral load is going to be very low. You can get exposed to some of the virus and your body can still fight it. But when you get too much of the virus, when that viral load is too high, that's when your body can't stop the infection and that's when it takes off. So here, from the Oklahoma State Department of Health. Thank you, Oklahoma. Y'all finally did something right. Just kidding. I'm a Texan. We love you, Oklahomans. We just have a funny way of showing it. All right. So again, they talk about how the mask isn't very effective for protecting you. However, they are also a very effective way to reduce the spread of viral particles. So that's why I'm not okay with Karen not wearing her mask, because I wear my mask to protect the people I interact with. I don't wear it to protect myself. If I get it, I get it. I'm relatively young and healthy. I shouldn't smoke, so that's not great for me. But otherwise, I'm in a pretty low risk category. But the people I interact with, the abuelitas that are at Walmart, those are the people that I could potentially infect. I could kill. If I interact with a small child who has some sort of immunosuppression, I could kill them because I chose not to wear a mask because it gets a little stuffy. One of the other arguments that I love is that the masks can't stop COVID virus from passing through. However, they're going to cause a dangerous buildup of carbon dioxide. So you can't stop a very complex virus, but it isn't going to allow carbon dioxide to be exchanged. So here, thanks to Professor Hamid Al-Awasi, I tried. I might have butchered it. I apologize. Appreciate your diagram. So at the very far right, we have a single atom. Carbon dioxide is 3 of those. But we have to move all the way over. I can't move my finger over there because you can't see it anymore. I'm sorry. But we move all the way over to the polio virus, and look how much bigger that is. If the polio virus could pass through your mask, CO2 is going to pass through your mask. At least it has some merit. There's an attempt at a scientific argument, but the science just doesn't work. All right. Now, thanks to the World Health Organization, they have a Mythbusters category. If you've got questions about wearing a mask, whether it's a surgical mask, whether it's a homemade mask, their Mythbusters section on the World Health Organization website is a great resource because they've come up with all sorts of arguments that I haven't interacted with. But the CO2 one has been a pretty common thing that I've debated. The prolonged use of medical masks when worn properly does not cause CO2 intoxication nor oxygen deficiency. There are people in all walks of life that wear some sort of mask for 12 to 16 hours a day. I can't imagine what kind of sheltered life somebody would have to live to think that wearing a mask for an hour in Walmart is going to cause CO2 hypoxia, it's going to cause hypoxia and a buildup of CO2, when you can go from the most entry level of unskilled labor, where they're wearing a mask for 12 to 16 hours a day, to the most prestigious neurosurgeon in the world who will wear a mask for 12 to 16 hours a day. There are people from all walks of life, from all of the socioeconomic levels, who wear masks all day, every day. So we know that they're safe, because these people are doing it and they're fine. Especially because we're wearing masks properly. We're talking about while you're in Walmart, while you're in the gas station. We're not talking about while you're raking your yard. All right, we're talking about very short trips. Now, there are times you don't wear your mask, and I honestly feel that there's been a lack of communication from the government and health organizations out to the public about properly wearing masks, and it's been the reason for some of this division. When you're wearing when you're exercising, if you're running in a park, out in the open air, you're not interacting with people, you don't need to wear your mask. All right, you're going to be safe. And the mask, all it's going to do is work your lungs harder. Normally, exhalation is a passive process. You have to use muscles to open your rib cage and create negative pressure that draws air in when you inhale. And then passively, all those things just kind of snap back and you breathe out. When you wear a mask, you have to work those muscles harder to create negative pressure to draw air in, and then you have to use active measures to compress your rib cage to push the air out. So you're going to work your rib cage, your respiratory muscles, and your lungs a little bit harder, but it doesn't serve a benefit as far as disease control or infection control. So you don't need to. And this is another example of why education is so important. All right. An N95 mask needs to be properly fitted. It stops 95% of particles from being inhaled. It has to be fitted to you properly. You have to use a reputable brand. You have to make sure it's fitted properly, because in the case that we have here, a New Jersey driver crashed because she was wearing an ill-fitting mask while driving. And that's the key that gets left out. As she didn't pass out because she was wearing an N95 mask. She passed out because she was wearing an improperly fitted N95 mask. But you don't need to wear a mask while you're driving. You don't need to wear a mask while you're interacting with the people you live with. You don't need to wear a mask while you're doing yard work. All right, but you do need to wear it when you go into Walmart or Kmart or Target or the gas station, because those are the places where you're going to be very close to people, and they may not realize that they're infected, and they sneeze, or just talking to you, they can expel droplets up to 1 to 2 meters. So that's why wearing your mask in those confined areas is important. But as we saw earlier, just a regular homemade fabric mask can stop 70% of the viral particles. So that's a huge decrease in the viral load. Medical masks like the N95 respirator really should be reserved for medically trained personnel who have been fitted properly, trained properly, and can wear them safely. Like we've seen, just making your own cloth mask, wearing a bandana. As long as you wear it over your nose and mouth, you'll reduce a significant amount of the viral load. So, back to our original question, should people wear masks? Answer's yes. That's all. Just yes. So I hope you learned something.